Please like the video, subscribe, and hit the bell icon to get notifications from us.
This is Vijayalakshmi. Today we are going discussing about the fundamentals of nursing. So fundamental of nursing means it is nothing but we are going to study basics in the nursing. So basics in the nursing, first we are going to discuss. First question is bleeding from the nose is termed. So some of the terminology we are going to use for in medically. So mainly some basic terminology everyone should know. Either it is the related of body, either it is related of any blood, anything it is increases or decreases. So are using for the terminology. So medical terminology. That's the thing we are going to discuss today. First question is bleeding from the nose is termed. Options are A. Hyperemesis, hemoptysis, B is hemoptysis, C is hematemesis, D is epistaxis. So in the four options low, answer is the D, that is the epistaxis. First of all, what is a hyperemesis, hemoptysis and hematemesis? So bleeding from the nose, what we are calling? Epistaxis. Why we are calling for epistaxis means because the bleeding from the nasal cavity due to of so many reasons mainly can the rupture of the blood vessels and can see for nasal mucosa, and it may be because of caused by the any trauma, dry air, infections, hypertensions and any platelet disorders. Anticoagulants therapy also it is one of the cause for to get for the bleeding from the nose. So this is term we are calling as a epistaxis. In the actually nose bleeds are categorized by the two types, that is the anterior and posterior. So anterior epistaxis is most commonly originate from the Kesselberg plus. So Kesselberg plus means it is for as a anterior nose wise can see for the one part of the nose, and posterior epistaxis more severe originate deeper into the nasal cavity. So this is also one type of bleed. So the both are the bleedings will be occur from the nose. Because of that we are calling the D is the answer is epistaxis. So hyperemesis means it is nothing but we can see for the extreme for vomiting in the blood. So vomiting is the blood we are calling as a hyperemesis. Then hemoptysis means we can see for nausea and vomiting in blood, excessive vomiting and excessive blood vomiting we can see into the we are calling as a hemoptysis. Hematemesis means it is nothing but we can see for very dark and brown color of blood is presenting in the vomiting, that is also hematemesis. So here they are asking the question is bleeding from the nose. So in bleeding from the nose they are asking, that is the answer for the epistaxis. Epistaxis means this is nothing but bleeding from the nasal cavity. Come for as a second question, that is an international touching of the patient's body without consent is termed. So what we are calling without touching of the patient in the body, with patient's body. So what will happen? What is the word we are saying? That is first one is the negligency, B is for assault, C is battery, and D will be malpractice. So in this four options low, answer is the C is the battery. Why we are saying the battery only is the answer? Because this is a medical law, it is referred for international physical conduct. For example, any procedure, either any type of care you are going to give before, first of all you should inform to the patient and to get the permission and have to do for the patient care procedure whatever. So before going to do for any procedure have to inform to the patient. That is the basic point for and first procedure point for the patient. So first of all, that is a anti-international touching of the patient body without consent term we are calling as a battery. So other things and all it is there for negligence sake. Assault means it is which is for threatening of harm without physical contact, that is assault we are calling. Then malpractice, this is malpractice also, this is not occur for malpractice. We are going to do for the procedure to the patient and without asking the patient permission should not touch the patient. So that's why we are calling as a battery. So battery is for answer to this question. And next question, abnormal lateral deviation of the vertebral column is. So third question, abnormal lateral deviation of the vertebral column is lordosis, kyphosis, scoliosis, osteoporosis. So what is first of all lateral deviation of vertebra? So mainly lateral deviation of the vertebral column is అంటే మీకు ఏం అర్థమవుతుంది అందులో abnormal lateral deviations means it is a unusual or unhealthy movement or shift off to the side. సో ఏమైనా అబ్నార్మల్ మూమెంట్స్ కానీ అబ్నార్మల్ అన్యూజువల్ థింగ్స్ ఇట్ ఈస్ హ్యాపెండ్ అయినప్పుడు సో వాట్ ఆర్ ద చేంజ్ వాట్ వీఆర్ కాలింగ్ దట్ మీన్స్ లాడోసిస్. ఫస్ట్ వన్ ఈస్ ద లాడోసిస్, kyphosis, C is the scoliosis and D will be osteoporosis. This answer will be for scoliosis. Why? Because first one can discuss lordosis. Lordosis means it is for can see for excessive forward curvations of the spine. So lordosis means most of the thing we are discussing. Kyphosis it is the mainly we can see excessive forward curvatures can be seen into the spine, and kyphosis we can see for mainly the upper spine will be rounded shape we can see, that is we are calling as a kyphosis. Scoliosis, because what is mean by scoliosis means it is for as a three-dimensional deformity with the lateral curvature of the spine and vertebral rotation. So vertebral rotation column will be have involved deformities we are seeing, so because of that we are calling as that is the scoliosis. Then osteoporosis, this become for as a brittle and fragile from the loss of the tissues, that's a abnormal and excessive and lack of vitamin D and C. This because of that we can see for osteoporosis. సో ఈ ఫోర్ ఆప్షన్స్లో ఓన్లీ మనకి కరెక్ట్ ఆన్సర్ అనిపించేది ఓన్లీ స్కోలియోసిస్, ఎందుకంటే ద అబ్నార్మల్ లాటరల్ డీవియేషన్స్ ఆఫ్ ది వర్టిబ్రా is the scoliosis only can be seen vertebra lateral curvature of the spinal cord and vertebral rotations only. So this is a so many causes will be there, but it is for some causes sometimes it is a idiopathic unknown cause and congenital also maybe, and sometimes neuromuscular disorders also. So these are all the causes for the scoliosis chance to get for the persons. That abnormal lateral deviation of vertebral column is answer is scoliosis. And come to this fourth question, the paralysis of both upper and lower extremities is known as. First one is options are, first one is hemiplegia, second is paraplegia, and C is monoplegia, and D will be the quadriplegia. So question first of all, listen, the paralysis. Paralysis means what? This is the nothing but loss of the ability to move of the parts, either most of the part, one of the part, either it is the most of the body. So because of the any illness or injury, anything that we are calling as a paralysis. Paralysis means you can see loss of ability move and can be see for the movements, either it is the parts, any body of the parts, either whole body also can see, that we are calling as a paralysis. Paralysis it is of both upper and lower extremities is known as, asking the question. So in that hemiplegia, paraplegia, monoplegia, quadriplegia, this answer will be D, quadriplegia. Why we are calling the quadriplegia? First come for hemiplegia means one side of the body will paralyzed, that is we are calling as a hemiplegia. And second one is only lower extremities, only there's a lower extremities of body, if it is paralyzed we are calling as a paraplegia. And monoplegia, only one single body part, either it is a hand or one leg or one right hand, left hand, either it is a right leg, left leg, any one organ body part will be affected, that we are calling as a monoplegia. Then D is a quadriplegia. Quadriplegia means you can see for any related of damages of spinal cord, the motor and sensory functions all over the limbs, like upper limbs and lower limbs, both will extremities will be get for the paralysis. Because of that we are calling as a quadriplegia. The spine mainly causes will be because of the trauma, either multiple sclerosis and spinal tumors, and sometimes you can see most of the times can be illness and injuries of the spinal cord. So these are all the reasons to also paralysis will be facing. Next, come for next question. Fifth question is Chauvistic sign. It is indicates. So what is the indicates of Chauvistic sign? If it is appearing of the person, that is options are first one is hypernatremia, hyperkalemia, and C is hyponatremia, D is hypokalemia. So first we are going to discuss what is mean by Chauvistics. Mainly what is mean by Chauvistics. So Chauvistics, it is nothing but abnormal twisting of facial muscle. Abnormal twisting of facial muscle, this will be occur for the because of some facial nerves abnormal, especially for cranial nerve. In the seventh cranial nerves, it is persons are affecting for these nerves, it indicates of any type of facial muscles, it will be twisting of abnormally. So that's the thing we are calling as a Chauvistic sign. We are calling that is a Chauvistic sign, abnormal of facial muscle movements. We can see into the person. So that is the options are hypermetremia, hypernatremia, B is hyperkalemia, C is hyponatremia, and D is hypokalemia. So what is the answer? It is D, hypokalemia. Why? Because hypokalemia means it is because of mainly what are all the reasons the people will get for this means hypoparathyroidism, vitamin D deficiency, and chronic kidney diseases. Because of this, the person will get for Chauvistic sign. So hypermetremia means it is for abnormality of high concentration of sodium in blood. So hypernatremia can see only indicates of increases the sodium level in the blood. Hyperkalemia means can be seen for can be seen for the low potassium in the blood is a high. So that's the thing we are calling potassium level, it is high in the blood, so that we are calling hyperkalemia. So hyponatremia, so hyponatremia means same, it is a sodium levels will be decreases in the blood rather than the normal. Then hypokalemia we can see for as a pattern, it is blood will be, the potassium will be decreases in the hypokalemia. So Chauvistic signs mainly can see for the facial nerves, facial nerve abnormality. So that is because of the vitamin D deficiency, thyroid deficiency, and chronic kidney diseases. So because of that, hypokalemia is the correct answer. Next, sixth one. The position is to be maintained for the patient with increased ICP. The positions to be maintained for the patient with ICP is on means what is the position, it is correct for the person to decreases for the ICP. Mainly what is mean by ICP means increase the intracranial pressure. So this intracranial pressure and which position if you give, the patient will be get for the decreases that ICP. The options are Fowler's position, Tenderberg position, sideline position, supine position. So Fowler's positions means what is answer is a Fowler's position. What is mean by Fowler's position means the patient will be two types are there Fowler's position, that is a Fowler's position, semi Fowler's position. So in this space Fowler's position slow, we can see for the head tilt will be up, means we are keeping for the head and bed will be elevated into the 30 to 40 degree, and that promotes will be the venous drainage from the brain and lowering of the ICP and improving of the cerebral perfusion. So because of that we can able to decreases the intracranial pressure. So that's why Fowler's position is the correct answer. So Tenderberg position means it is opposite of the Fowler's position, means we are making the lower limbs will be the high and upper limbs we are keeping for the down, exactly 15 to 20 degree of 15 to 20 degrees Celsius the person will keep for the down of the body. So that time head will be low and lower limbs will be high, that is the opposite of that. So it can increases the ICP because of Tenderberg's position. Next, sideline position, it is in the supine position, patient will be right side or left side, we are turning into the patient. So that time also we cannot see for the any type of changes in the ICP. Next, supine position, it is normal position and sleeping position. This is for people can't able to reduce for any ICP pressure in this position also. So because of that, the Fowler's position is the correct answer for this. And next come for the pressure to be set in seventh question is the pressure to be set in autoclave for sterilization. So what is the first of all should know for what is mean for the sterilization. Sterilization means we are going to kill the microorganisms and bacteria of the equipments. Sterilization, that is a one type of autoclave, is set of the autoclave. Autoclave means that is a one type of instrument. In that instrument we are going to one mission. In that we are going to do for sterilization of equipments. So main what are the options they given for means between 15 IB and 5 B is the 5 IB, C is the 10 IB, and D will be the 20 IB. So what is answer is the 15 IB. So what is mean by 15 IB means it is the 15 pounds per square inches. This is the one pressure we are keeping for in a autoclave. So this is a very standard pressure for to kill the organisms. Because of that we are the answer is the 15 IB. This autoclaving is the moist under pressure, it will be kill the microorganism including the spores. The standard temperatures and parameters are temperatures 121 degrees Celsius, pressure is 15 pounds per square inch, and time will be for 15 to 20 minutes. So then only can able to kill for the microorganisms. And next come for as a 8th question. In lumbar puncture the needle is inserted between. So lumbar puncture is performed below termination of spinal cord. So normally the spinal cord will be, everybody knows spinal cord will be divided for the parts. So what are the five parts will be divided? Mainly the spinal cord will be divided into 5 parts, and there is a 33 vertebrae will be there for this. Mainly we are divided into the 5 means cervical, thoracic, lumbar, sacral, and coxillary. So mainly cervical 7 vertebrae. Cervical will be 7 vertebrae, thoracic has have for 12, and lumbar is a 5, sacral is a 5, and coxillary will be the 4 fused vertebra. So this is the spinal cords of 5 parts. In that the lumbar puncture, the needle where they are going to give for the injection. The lumbar puncture for using for to give anesthesia. Mainly answer A will be the L3 L4 space, and B is L1 L2 space, and L4 L5, D is L2 L3. So normally L3, L1 and L2 for adults usually can give for spinal cord, but it is avoid for injury, and performance site will be L3 and L4. Either it will be for L4 and L5 intravertebral space. Mainly we are giving for the L3 and L4 of space between for the vertebra. Then only it will be can able to give for, then only can see the CSF fluid identification. So once if the person has pricked for that needle inserted into the spinal cord, especially for L3 L4 space, then we can see observe of the CSF fluid means cerebral spinal fluid, that present means it indicates that is the correct position of the person. Then can give for any testing sake they are going to do, either doing for giving the anesthesia. So this answer will be the L3 and L4. And next come for as a ninth question. The apex beat is felt at which intercostal space? The apex beat in felt, what is mean by apex beat means mainly can see for apical impulses of the, briefly can see left outward maximal out to the left ventricular to the head against the chest wall, that is beginning for the systole, valuable information about for the heart functioning. Mainly this apex beat will be for what is the heart functions, how the impulses will be appearing of the ventricle of the against of chest wall. So that we are going to identify. So what are the options are given? Third, fourth, fifth and sixth. So third and fourth and fifth and sixth mainly can see for the C is the fifth. Why the fifth will be the answer means the apex beat will point will maximal impulses, that is a PMI of the heart, usually felt at is for the left fifth intercostal space. Because of that we are calling answer is the fifth. And next mid clavicular line will be also it is present into the fifth intercostal space. Because of this point only we can able to identifying for the that valuable information about for the heartbeat. Then the correspondent of the tip of the left ventricular during the systole and displacement of the apex, it is indicated for the enlargement of lung pathology also. So these are all the things we are going to felt on the apex. So that is the why answer is the fifth. And next question is 10th, that is the fasting blood sugar value is. So what is the fasting blood sugar value? Normal blood sugar value will be, it is indicates for 70 to 99 mg per dl. But what is the fasting blood sugar means? And the options are 70 to 110 mg per dl, B is for 50 to 90 mg per dl, and C is 120 to 180 mg per dl, and D is 180 to 200 mg per dl. The answer is for A, 70 to 110 mg per dl. Why? Because the normal fasting blood glucose range will be for 70 to 110 mg per dl. If it is hypoglycemia, it is decreases means in the fasting blood sugar decreases means lower than the 70 mg per dl. If it is impaired fasting glucose, that is the level will be for 111 to 125 mg per dl. If it is diabetes, more than 126 mg per dl. So because of these are all the ranges, maintaining of prevents the complications of diabetic ketoacidosis or hypoglycemic coma. So once the person fasting blood sugar value will be 70 to 110, it is a normal. If it is persons are will be get hypo, either any impaired of glucose fasting glucose, either it is in the diabetes, we can see for the less than 70 and can see for the more than 110, and then can see more diabetes means more than for 126 mg per dl. So thank you.